In Chapter 14, we look at adolescent stress and alienation. It is important for us to understand that adolescents do experience stress and alienation. Oftentimes, their behavior is looked at as problem behavior, but actually, it could just be anger and unhappiness that they are expressing in other ways. A lot of times, it will be shown in acting out behavior, such as truancy, aggression, promiscuity, theft, or assault. Alienation is the combination of 6 beliefs. They feel powerlessness, meaninglessness, self-estrangement, cultural estrangement, normlessness, and social isolation. Again, these will manifest themselves in things such as running away, eating disorders, and delinquency. These problem behaviors tend to cluster because they come from a common cause. For example, family discord may lead to one behavior that can then trigger another behavior, such as running away and drug use. The prevalence of running away is very high. 1 in 5 teens will run away at least once before their 18th birthday. The risk factors that predict for us the tendencies for a child to run away are things like family structure, teens who have been victimized at school or at home. Girls are more likely to run away than boys, and older teens are more likely to run away than younger teens. There are different classes of runaways. Intent runaways are those who are intent on running away. They want to leave their situation, and they are very real in their decision to run away. Transient runaways are those who leave kind of spontaneously because something has happened, and they typically return within 2 days. Throwaways are those children who are actually thrown out or encouraged to leave by whoever they are living with. Reasons for running away: oftentimes there may be a dysfunctional home life, there may be abuse, there may also be an instance of the teen actually being encouraged to leave, just like we mentioned in throwaways. Of runaways have actually been thrown out or encouraged to leave. Leads to parents forcing their children to leave or encouraging their children to leave. Distress over the child's behavior. Mental illness in the child can cause difficulty living with them. If the child has engaged in incest with a sibling or a parent, all of these are reasons for possible throwaways. Life on the street is not good. Almost half of teens report being assaulted or victimized. They experience a number of serious health problems from a lack of sanitation and risky behaviors. They're more likely to have acute illnesses and STDs and unwanted pregnancy. Because they do not have money, oftentimes they have to panhandle or steal, and many engage in survival sex so that they can get money, food, and other resources. There is help from runaways. Emergency shelters are needed. More of these are needed to provide them with a place to sleep and food. Medical care is needed, both physical and psychological, and also social workers are needed to help unite them with their families or find them a new home. Depression is a serious condition, obviously with a number of negative consequences. Depression usually includes feeling helpless, hopeless, high levels of self-criticism and self-neglect. Adolescents who are at risk for depression or adolescents themselves are at a higher risk than younger children. Also, if there's a family history of depression, stress within the family also puts adolescents at a higher risk for depression. Depressed adolescents are at an increased risk for suicide. One of the most common treatments is antidepressant medication, SSRIs, such as Prozac, is oftentimes prescribed for depression, but unfortunately they can trigger suicidal thoughts and behaviors in adolescents. Suicide is the third leading cause of death among teenagers following accidents and homicides. Suicide rates are the highest among Native American adolescents, followed by Caucasian, then African American, and then Hispanic. Equally common in boys and girls during childhood. However, girls' depression rates do increase during adolescence, where boys' rates do not. Suicide, what family factors are associated with suicide? Parent psychopathology, or having a parent who attempts suicide, puts the adolescent at both a genetic and environmental risk. Substance abuse by the parents, poor parent-child relationships, all are factors associated with suicide risk. Other factors associated with suicide, if the teenager themselves are under the influence of drugs or alcohol, or if they have psychological problems, or if they are gay or lesbian. Oftentimes, these can be factors associated with suicide. It is important for us to recognize the predictors of suicide, such as loss of a loved one, depression, substance abuse, or social isolation. Also recognize that the signs of suicide may be imminent, such as declining school or work performance, a lack of interest, self-abuse, or suicidal talk. Always listen and provide support. Don't leave the person alone, and get help. Non-suicidal self-injurious behavior. This is forms of self-injury and self-mutilation. This is not a suicide attempt. Examples of this include cutting, or picking at wounds. For many teenagers, this is a coping mechanism, a way to relieve negative feelings, resolve interpersonal problems, or to induce a positive mood. Eating disorders are also something that we begin to see in adolescence. Anorexia is a case where the adolescent actually is starving themselves to death. They must be 15% under their normal body weight. They have an intense and excessive fear of gaining weight, and they have a distorted body image in which they do not realize how thin they are. There's also bulimia. With bulimia, the person participates in repeated episodes of binge eating, and then they engage in excessive compensatory behaviors, such as vomiting, using laxatives, things to get rid of everything they've eaten so that they can avoid gaining weight. The individual must unduly allow his or her weight to influence their self-esteem. Then there's also a diagnosis of binge eating disorder, in which you have the presence of these binging and purging behavior that has gone on for at least a week, from at least 1 week to at least 3 months. Juvenile delinquency is defined as violation of the law by a juvenile. It is a legal term. It was put in place to protect children from being judged and tried as adults. Violations of laws that apply to minors may be underage drinking, curfew violations, truancy, things that oftentimes we would consider status crimes. The causes of delinquency, there's 3 main categories of causes: environmental, which may be the adolescent's neighborhood or community; interpersonal, which could be influences by family, friends, siblings, and peers; and then personal causes, such as personality traits, antisocial behavior found within themselves. Juvenile gangs is an issue. Engagement of youth in gangs is a major crime problem because gangs often commit violent crimes. Gang emerged as a major problem in the 1980s. Today, there are about 27,000 to 30,000 youth gangs in the United States. Many of them are kind of centered around larger cities. They are likely looking for adolescents who have some type of family dysfunction, and so this is why these adolescents actually seek out gang membership. Arrest involving juveniles by the type of crime, and this is according to 2012. Arson being the highest percentage, but you can see other types of juvenile crimes listed in this chart as well. Violent crime rate from 1980 to 2012, it looks like there was an increase in the mid-90s, but fortunately we are seeing a bit of a decline. The juvenile justice system for adolescents. Typically, the police are the first point of contact for adolescents who have committed a crime. It is up to them how they handle it. Oftentimes, they can give a warning, refer the teen to other services, or they can go ahead and make an arrest. Juvenile court then handles the judgment and prosecution of the teen. The correctional system will decide their ultimate fate. And then some cities also have juvenile bureaus that serve to protect the juvenile, to try to prevent delinquency, investigate, and dispose of cases. Juveniles who must go to court may be faced with several possible outcomes. Could be dismissed. They may have to participate in private hearings with the judge in his chambers. The judge can try the case in formal hearings, or they may be transferred to adult criminal court. The correctional system, usually what happens, probation is typically the first step, especially for a first-time offender. Most juvenile correction systems include some type of detention center, and then only a small number of juvenile delinquents actually end up serving in adult prisons. Counseling and therapy, both individually and in groups, are an important part of this program, because we want to see these juveniles get help early on so they do not end up growing up becoming a criminal in adulthood. The restorative justice movement is kind of a newer trend with juvenile delinquent rehabilitation. It tries to balance the needs of the victim, the community, and the juvenile perpetrator. The perpetrator is required to meet with his or her victim to make restitution. The perpetrator is given education, counseling, and community service. And this approach helps offenders become more morally mature and gain a feeling of integration into the community.